Hi, I'm Amy.
And I'm Steven. I was diagnosed with chronic myeloid leukemia, CML, in 2011. I experienced a lot of different side effects from my treatment, which was an oral chemo pill called Tasigna, or nilotinib.
So here are some tips if you're dealing with side effects due to your treatment.
Awareness. It's important to take notes and to be aware of when you're dealing with the side effects. What time of day is it? Does this only happen in the morning? Do you feel it at night? Do you feel it after you eat or after you drink? All these things are just additional data points that can help you understand what's going on and help your medical team understand what's going on. For example, for me, I dealt with the restless leg syndrome, but that was only at night. So during the day, it wasn't a problem.
Understanding your personal patterns when it comes to your side effects is so important. So what I'm talking about here is learning about how your body, your specific body, tends to react. And this takes time to learn, and it really takes a lot of awareness building, which involves oftentimes note-taking, journaling, taking pictures, and really being in touch with how you are feeling on a daily basis.
These are the list of some of the side effects I had while on my cancer treatment. We've also learned that having a daily health routine really helps with minimizing the side effects. We heal every day together, also the name of our channel. We made sure we had healthy headspace, good eating habits, were very active, and had a healthy lifestyle, such as sleeping well and limiting alcohol.
And this is honestly something we do every day. These four things we have in place every day as part of our daily health routine. It's a daily practice to be healthy. Being healthy is not something you are, it's something you do.
I mentioned this earlier, but get educated. It helps to know what other people are dealing with. Read message boards, talk to your doctor, talk to your nurse, ask as many questions, learn as much as you can, and that really, I think, helps you understand, hey, this is a common side effect, and it's going to be okay, or this is something that not many people talk about, so maybe you want to bring it up to your doctor and see what they have to say about it. I read books, I got on message boards, I attended conferences, we listened to webinars from the Leukemia and Lymphoma Society. I just did everything I could to really understand the CML, and that helped me a ton.
When you do get educated, sometimes there is a lot of science, but I don't want people to feel discouraged by that. Okay, there's science in some of the literature. Maybe you don't understand it, but read it anyways, and it'll sink in on some level. And as you continue to read, you'll continue to understand things better. Please communicate with your medical team.
Right, don't suffer the side effects alone. Ask questions and don't be embarrassed. There's no right or wrong question with a cancer diagnosis. And ask the same question multiple times. Ask your nurse, ask your doctor, see if they give the same answer or if they have slightly different opinions on it.
Steven's nurse always gives us great feedback on the side effects that he was dealing with. So she would always give us a sense, oh yeah, lots of other survivors deal with this. These are the options you have to deal with it, or maybe the side effect might go away after X, Y, and Z time. So it really gave us a lot of peace of mind and comfort to know that other people were dealing with the same side effect, even though honestly, we could see it on the prescribing information on the Tasigna website. Even though we could see that, and obviously people are going through the side effects, for some reason, hearing it from the nurse was just kind of an extra layer of comfort that was really helpful to us.
And even if you don't care about the side effects and it's not bothering you, it's important to mention it to the medical team. They keep track of all these side effects as a data point, and so they can help other survivors, stay informed and do their own research. So it is important to just keep tabs on all your symptoms, regardless of how severe they are.
If the side effect does down the road become a problem or a nuisance, then you kind of have already a history of having brought it up with your team. So for example, I remember when you told your nurse that you were experiencing some thinning hair, and what did she say?
Oh yeah, she mentioned that was common, but that she didn't have any patients that had lost the hair in their head.
Right, so that was just something interesting for us to know. Yeah.
So some side effects, you can take care of your own, like my restless leg syndrome. I drink water. Other side effects you might not care about, like your hair. I'm like, not a big deal. And then there's another group of side effects where you might need to see increased monitoring because of it. You need to talk with your doctor about whether you need to change your meds to deal with the side effect, reduce the dose, or a second medication to manage the side effects.
I think your glucose was one of the examples of something you just kind of monitored, and we would have a conversation about that each time we went to see the doctor.
So if there's someone that maybe had a higher risk for diabetes, then maybe they wouldn't put them on Chisigna or keep them on there for long because there is the risk of increased glucose.
So if you can't take your medication because your side effects are too severe, then honestly something probably needs to change. And in our case, Stephen had to change the dosage. So maybe there's a different treatment that could be suitable to you, and there's lots of different treatment options for CML, which is great news.
Met people online that were going through the same symptoms and situation, and you realize that you're not alone, and also you understand like what does work and what doesn't work, and when to worry and when not to worry. And if there was worry, I knew in the beginning I could go onto the message boards and post a question, and there would be people that were on there that experienced it and be like, don't worry about that, this will go away, or do this instead. And that was ultimately one of the best ways that I learned to deal with the CML, just to understand as much as I could about it.
Know when you need to get additional help for your side effects. This sometimes takes some experience to know when you need further interventions, which is why communicating with your doctor and getting educated is so important.
So for example, I was told that I had to go to the hospital if I get a fever of 101 degrees or greater. And with my skin infections, there was always a point where I knew that I just couldn't monitor it anymore, and regular Neosporin wasn't going to work. I knew that I had to get antibiotics from a doctor.
So in closing, we're here to support each other and learn from each other, and we're all part of Team Heal, and we want to hear from you.
Our question of the day is, what are some ways you manage your side effects? Comment with your answers below and we'll write back.
Hit the subscribe button and the bell to join Team Heal. We all need teammates to support us in living a healthy lifestyle.
We're here to coach cancer survivors and caregivers on how to live healthy lives, and we want you to be part of our team of healing.
We're Amy and Stephen from the Heal Every Day Together channel. Check out the link below to our website to find out more about our program for cancer survivors and caregivers.
Thank you for joining us today.
Together we heal.